a time. This is Tac S3 show with Tony and the gang. Your boy is here again. Your black to the bone guy is here again. My name is Yomi Oyelami. I'm so happy to bring you this episode 9, where we are going to be talking about something that is very interesting. I can tell you, it is something that you have always experienced. So you are going to enjoy this session. Don't worry. I have a particular special guest with me today, a doctor as well. You know, in this space, we've interacted with doctors a lot and we're having fun. Today, I'm going to be having Dr. Brume Orume with us.
Welcome. This na Baba Shukura radio drama.
They say a child born with sickle cell can live beyond the age of 21. They say sickle cell is a death sentence. They say they can't hold a job or run a successful business, that they can't live a healthy, productive life. They say. But is this true? Join Tony and the gang on the Tac S3 show.
We are going to be talking about something that is very interesting and something that has been very controversial in our environment. It is malaria and typhoid. Again, now only them come. Well, that's it. In this environment, we get to deal with malaria and typhoid and all that. We just hear it again and again, and it's just like it's a regular thing. So we said, why not bring it to the show and let's dissect the topic. So today, I'm going to be bringing my guest on without further ado. And as I'm bringing him on, I'm going to be reeling out his bio. And here is our doctor, Dr. Brume Orume. Welcome to Tac S3 with Tony and the gang.
Thank you very, very much, sir. It's my honor to be here. All
right, fantastic. It's an honor to have you as well. So, but let me do your honors this evening. Dr. Brume Orume is a seasoned medical doctor with years of practice post-training. He has interest in pediatrics, public health, and managing people with sickle cell. And obviously, that's why he's here today. The graduate of medicine and surgery from the prestigious University of Lagos currently works at Lifelink Clinic, a private medical center located in Surulere, Lagos. Brume is enthusiastic about chess, swimming, and the crypto market. You know what? You know what interests me about your bio? This doctor is his life. So good to have you around, Dr. Brume.
Yeah, thank you very much. It's a pleasure to be here. Thank you so much. Thank you for having me.
Fantastic. So, Dr. Orume, our people, they want to know this malaria thing that I've been talking about. Their parents, they told them about malaria. Their grandparents, they told them about malaria. Their great-grandparents, they told them, their ancestors, they told them about malaria. What is it with us Africans and malaria? Please, let's start from there.
Okay. Well, unfortunately, malaria is endemic in the African continent, right? We cannot run. Okay, sorry. And okay. What I mean by endemic is it is a part of us. It is in this our locality. It is in Africa. It is always present, season in, season out, year in, year out. There are some places where you go around the world, they don't know what malaria is. They don't know anything about malaria. You know, so malaria is like our own body in terms of one of the diseases that we face in Africa. So that's what I mean by endemic. I'll cut down on those terms. But so malaria is here with us to stay. That's the word. Yeah.
All right. So is it that okay? So how does it happen? Is it that the mosquitoes, they just like us? Is our blood gas sweet? What's happening? So what's the connection between? Please explain.
Okay, so you know how in certain parts of the world you see some kinds of animals. Let's start with animals.
Yes.
See some kinds of animals. In other parts of the world, they don't know, they don't have those kind of animals common to them.
Okay.
So let's look at mosquitoes like that. The climate we have in Africa, the seasonal changes and everything, they are near perfect for the life cycle of the malaria parasite. So that's why they are comfortable in it. That's why we have them in this region. I'm just trying to remember some kinds of animals that we don't have here. There are some kinds of animals like the African crocodile. You only see it in, I think, the Nile region. You will not see that particular species of crocodile. Go the headers, that's a perfect example. The polar bear. You see the polar bear in the extremes of the earth. I think the Antarctica or the Arctic. I can't remember. The very cold regions. You can't see a polar bear here. And if you bring one here, it will not thrive. It will not survive. So that's how the mosquito is to us. Yes, that's a simple way of putting it. Yeah.
Wow. So this mosquito, my people, they will say, this mosquito, if you bite me and you just go, I'll be very happy. You will bite me, you still put something inside. What is that something that you used to put inside that used to cause malaria?
Okay. So that thing that the malaria puts inside us, we call it Plasmodium species. There are about 5 of them. I don't want to go into the names of them, but generally, it's a parasite, right? We call them Plasmodium species. So they stay inside us, feed on us, live, reproduce in us, and then other mosquitoes now take some from us again and go and put it in another person. So that's that's the connection between us and mosquitoes. They need us to complete their life cycle. A part of their life cycle occurs inside the mosquito itself. But until the mosquito transmits that thing into us, they cannot finish up their life cycle. You understand? So that's the connection between the mosquito and us.
And us. Okay. Now, another aspect I will bring to this conversation is this typhoid thing that comes in. Is it mosquito that brings typhoid also? I mean, what's the connection? Usually, when you go to a regular hospital, a regular pharmacy, somebody by a next door, the moment they see you, it's malaria, it's typhoid. What is the problem? Is malaria also, is the mosquito also carrying typhoid?
Okay, that's a very good question. So malaria and typhoid, two different things entirely. Two different diseases entirely. Yes, they might have similar presentations. You can have typhoid and think it's malaria. You can have malaria, think it's typhoid. You can even have both of them. And but yeah, ideally, typhoid is the causative organism for typhoid is what we call Salmonella typhi, right? There are different types of that one, but I don't need to go into it. But it's majorly, let's just say the Salmonella typhi. That's what causes typhoid. And just like malaria, it is also part of us, so to say. It is part of it. It is found rampantly in certain areas, places where you have dirty water, where the environment is dirty, or people who don't have free access to clean environments. We get typhoid through contaminated food and water, right? So there are some places where you have gutter pipes running through the gutter that is leaking and is contaminating their source of drinking water and all that. So that's one of the challenges that makes typhoid a part of us. Now, why usually, yes, you are right. Sometimes when we go to do a test, you see malaria and typhoid, or you see one of them. It's very common. And to a large extent, these tests are correct. Not all the time anyway, but yes, to a large extent, they are correct. So what I mean by that is you can have the malaria parasite in your body without exhibiting any symptoms. The person is going fine. And then certain people are susceptible to this malaria parasite easily. There are certain groups of the population that they are able to, their immune system sometimes cannot fight off the parasite. So you see you see the parasite in their blood when we do a routine blood test. Same thing with typhoid, right? But the typhoid one is even much more questionable, because almost everybody you check, you see the titer value and they say it's significant for typhoid. Well, some people have carried out some studies and said, well, not everybody, this test is not reliable. In fact, some people don't recognize the so-called white dye test Personally, I don't recognize it. I don't treat based on, oh, you want to do a wider test.
That wider test is used to get typhoid, right? Okay.
Yes, it's to get typhoid. Yes. Okay. But we find out that almost everybody where you do the typhoid test, that wider test, you see typhoid. Which, well, I wouldn't say is I can't vouch for it, right? I can't really vouch for it. But even malaria, like I take malaria for example. Malaria is, like I said, is a part of us here. Even a person who is not showing any signs or symptoms can have malaria. When you check the person's blood, yes, you can't see the malaria parasite. Our immune system, we have developed some form of immunity, to the malaria parasite. But even when we have it in us, we are not showing any signs and symptoms. So, summary is, yes, malaria typhoid is common here, but not everybody who does that wider test is not a reliable way of determining who has typhoid.
So what's the reliable test?
Well, so far it's still the most common one. I'll still maybe need to check up on it on what the current test we use for typhoid. But the most common thing we have is the wider. That's the most common thing we have. It's wider test. Okay. Yes.
Oh, okay.
Yes.
Okay, so that means if
and of course,
wider test is conducted on anybody and it shows traces of that organism that you mentioned earlier, that means that person is likely to have typhoid. That's the meaning, right?
Yes, the person is likely to have typhoid, although we cannot fully rely. Sometimes you also have to depend on the signs and symptoms that the person presents with to rule out or to confirm that typhoid.
Can the environment also play a part in all of this? For example, somebody that is living in a slum area, does those things play a part in this malaria typhoid issue?
Yes, it plays a very, very, very important role in the disease malaria and typhoid, in those diseases. Okay. Like I said, example I gave before for typhoid, certain areas we see that yes, these children or adults are prone to typhoid because of the poor hygiene for their drinking water and food.
Poor hygiene.
Yeah, then for malaria too, in some places in Lagos State where you have in the riverine areas, where you have stagnant water, swamps, there's a high level or high chance that you find more people infected with the malaria parasite than in certain other areas. Maybe like you mentioned slums, for example, where there's a lot of, they don't have access to mosquito nets, sometimes they sleep in the open in places that are poorly ventilated, sleeping when you rainy season now, you will see a lot more cases of malaria because one of the things that the parasite needs to breathe is stagnant water. Sometimes people have dirty water around their environment, maybe the road and all that, swamps and all that, death generally. So yes, the environment is a very, very, very important role in the transmission of the malaria parasite.
Wow, fantastic. That's quite interesting to know. So our environment is actually very critical, plays a very critical factor in all of this.
Yes.
Okay. So let's go and have our sickle cell community news.
News. My name is Sandra Onslike. On the news today, Benel's Children's Hospital opens new center for pediatric pain, and Sami urges Nigeria to donate to 1K for sickle. The news in full. The UCSF Benel Children's Hospital in California has opened a new center where pain in children living with disorders like sickle cell will be treated. The center, named Start Center for Pediatric Pain, Palliative and Integrative Medicine, was established by the generous donation of $3 million by Elisa and Mark Stard. Sami urges Nigeria to donate 1K for sickle. Sickle Cell Advocacy and Management Initiative, SAMI, has enjoined well-meaning Nigerians to support its ongoing 1K for sickle campaign with the aim of raising 2 million naira to help beneficiaries who are battling chronic conditions like leg ulcer, stroke, etc. You can donate using their respective fundraising details. And this concludes the Sickle Cell Community News for today. Kindly join us next week for a fresh package. Thank you.
The said child born with sickle cell can live beyond the age of 21. They say sickle cell is a death sentence. They say they can't hold a job or run a successful business, that they can't live a healthy, productive life. They say. But is this true? Join Tony and the gang on the Tac S3 show.
I hope you enjoyed the community news I will just add. That's how we do it every week. We bring you news, updates in the sickle cell community. We want you to know about what's happening from place to place and what we are doing as an organization, Sickle Cell Advocacy and Management Initiative. So that's the idea of the Sickle Cell Community News. We are going to have it again next week. So join our newscasters. All right, we are back to malaria and typhoid again. Malaria is a childhood killer in Africa. Doctor, malaria is a childhood killer. How do you come about that?
Yeah, it's a combination of factors, right? It's not just the immune system. It's a combination of other factors, finances, access to health, the condition of even the mother before pregnancy, during pregnancy, and after pregnancy, amongst other things. Like, so I'll just try and keep it simple. So ideally, during pregnancy, even before pregnancy, parents should plan for pregnancy, right? And the management for pregnancy starts even before conception.
They should plan. Doctor, wait, let me emphasize that. Let me underline that.
Yes.
Parents, they should plan for pregnancy. You don't hear?
Exactly.
Doctor, continue.
So it's not until pregnancy comes that you start rushing. Okay, ideally, when you are planning to conceive, you should already be seeing a doctor. So now, so the factors that I'm talking about now, let's go to during the pregnancy. One very important thing is the antenatal care in a woman. It's very, very important to prevent certain conditions or even manage certain conditions that they might discover or that she has had prior to conception and pregnancy. Malaria is one of those important diseases or conditions. So again, talking about the factors, a woman who malaria has devastating effects on both the mother and the child during pregnancy. So one of the factors that affects children who are born, nowadays is access to healthcare. You see some women don't go for antenatal months after they know they are pregnant. Sometimes 6-7 months they don't because of finances, illiteracy, and so many other things. Again, nutrition during pregnancy is very, very important. Those are some of the factors. I don't want to because of time. So nutrition is very, very important. The health status of the mother important. And even during delivery, where she has a child, where she's delivered of that child is important. And even after, right? So even after delivery, sometimes you see mothers who do not take their children for basic immunization. This impacts on the overall health of that child. Yes, we might see it as common, but there are still places in Nigeria that they don't have access to all these things, which we see as normal. And again, illiteracy. Some mothers do not understand it. They don't know the importance of breastfeeding their child, exclusive breastfeeding. These are little factors. There are so many. These are just little factors that can impact and affect a child who is born into an environment like ours that is known for malaria. So yes, those are some of the factors that yes.
You've given a lot of information in just that 1 minute. You talked about the importance of breast milk, breastfeeding. Talk about
antenatal care.
About antenatal. You talked about vaccination. Wow! These are very important things that we need to pay attention to. Breastfeeding.
Yes.
You don't need government to tell you. It's something that you can do. It's something that you can do.
Yes.
Now let's come to malaria and sickle cell for people like us who live with sickle cell. Malaria, we always talk about it. You doctors, you tell us about it. But can you just expatiate more on why we really, really need to fight malaria? as people living with sickle cell?
Okay. Now, sickle cell already predisposes one to what we call anemia. So let's just what we call reduced blood levels, right? Hemoglobin levels that are
reduced blood
right?
level.
So yes, reduced blood level. Putting it simply, just simply, right? Now, when you now have malaria on top of that background picture, it tends to worsen it, right? And somehow we've realized that the sickle cell the malaria parasite thrives a lot more in patients who have sickle cell, in warriors. Let me use that word, in warriors. So that's why we aggressively fight malaria in warriors. You understand? Even if it's a plus, you should start treatment. Once you have evidence of the malaria parasite, you should commence treatment. So in order, like I think earlier I mentioned that there are certain people who are susceptible to the malaria parasite. Some of us can stay with the malaria parasite for a long time, no symptoms, right? No symptoms whatsoever. But we've noticed that certain people who are immune, who have their immunity compromised already, who have weakened immune systems, are not able to fight the malaria parasite. So when there is excessive parasitemia, when it multiplies and gets to a level, it breaks the person down, right? And sometimes, for warriors, they have, aside this HBSS, they have other probably underlying conditions that still further weaken the immune system. So that's why we don't, so it's all about immunity. We don't joke with malaria in warriors at all. So that's why you see doctors always emphasize it. A patient, a warrior comes in crisis, we routinely check for malaria to know that, okay, is this thing triggered by malaria? Is there something else? But why we want to check for malaria first is because it is one of the most common causes and things we see in warriors.
In warriors, fantastic. So, doctor, that will bring me to this part where warriors or even people in the general population, they just say, I know my signs, I know my symptoms. When it's malaria, that thing, they'll just go and buy malaria drugs. I know my signs, don't worry. When I start to feel this headache, I know all that. How do you address that? Should we go that route? Let's talk about that.
Okay. You see, let's talk about the standard. What should be done? How it should be approached? Standard, according to World Health Organization. You shouldn't treat malaria unless you have evidence that this person has malaria by running a test, a blood test, right? That's what should prompt your decision to treat malaria. And why is this? This is because so many other diseases mask malaria, or they look like the symptoms that we have in malaria. Conversely, or vice versa, malaria also mimics a lot of other disease conditions.
Wow.
A lot of other disease conditions.
So that's what you're saying, that we have a lot of diseases that when you see them, you'll be seeing symptoms like malaria.
Exactly. And also, malaria presents like so many other diseases. So where the person thinks,
so that is why we really need to find out, is it malaria truly?
Exactly. So that you are not fighting something that is not there, whereas something else is going on and probably causing damage, right? So, like malaria can affect virtually every organ of the body. You can have malaria affecting the brain, because cerebral malaria. You can have malaria affecting the liver, the kidneys, the urinary system, the abdominal. It can affect virtually every organ, even the heart, organ system of the body. So we are usually very careful when it comes to malaria. And then when it comes to malaria in susceptible populations, that's people who are, who can come down from having malaria easily. So in approaching that, there's a standard. I've talked about the standard. But then again, there's what I like to call the way we do things on the streets. Sometimes not every time we are doing things ways, So yes, some people just, okay, I feel I have malaria. Let me just go and buy the medication. Let me go and buy the doctor and walk into a pharmacy. And more often than not, yes, people get better. So sometimes it's okay to just, I know my signs, let me just go and buy this. People get better. But other times, when people notice that, I'm not getting better, they should come to the hospital, see a doctor, let's check and see if there's any other thing going on. But oftentimes, you see people they will just want to manage and live with it. I'll get better. or they'll go and buy this, I'll go all this native, I'll be okay, I'll be fine. That's where the danger is in self-medication and self-prescribing and treating without evidence. Yes, that's the challenge with that. Yes.
Fantastic thought there. Fantastic thought there. So still in that light, we heard last year of a malaria vaccine that was discovered, that was announced by the World Health Organization as a vaccination that can actually prevent people from having malaria. Do we have it in Nigeria? And then why? How does it work? Is it something that can really work in this society?
Okay. So the first question, yes, it's true. There is now a malaria vaccine that has been approved by the World Health Organization. I think October 2021, it was approved. Do we have it in Nigeria? I have not seen it personally. Wow. And if I'm going by the book, I'm not sure we have it in Nigeria yet. Yes. Well, I might be wrong, so don't quote me on that. But as far why we don't have it in Nigeria, there's a whole lot of politics involved in availability of vaccine to third world countries like us, let me use the word third world, underdeveloped countries like us, or developing countries like Nigeria. There's a whole lot, because we don't manufacture. Sometimes we don't have the resources to preserve. Transportation might be poor. Then also a lot of other factors, like if you bring a vaccine into the country, in a place like Nigeria, you are pushing a lot of other people out of business. So imagine the man who makes a lot of money selling malaria drugs. You have a vaccine, you will have very poor sales. So all these things, there are a lot of political undertones to deciding whether this vaccine can be available here or not. Again, don't forget that we don't manufacture these things. People over there abroad in those developed countries who manufacture spend a lot of money, billions of dollars in research and all that. And I don't, sometimes they find it difficult, reluctant to just, okay, we found the vaccine, let's throw it open, let's give it to Africa. One of the reasons why the COVID vaccine came out so fast is because it affected virtually everybody in the world. Every country was touched. I think until maybe even recently North Korea, despite how stringent they are, they announced the first case of the COVID virus. So it touched virtually almost everybody. So that's why they needed the speed with which it was aggressive. But you see, Africa, the white man doesn't have a burden of malaria the way we have it here in Africa. So why should we be interested in helping us? It doesn't really affect me. So what they do is, yes, they know that they are going to make a lot of money if they can make these vaccines available to us. But at the same time, they will not just throw it out because it's an investment. They are also profit-making organizations. Yeah.
So a lot of things are involved in the malaria vaccination drive. Okay.
Exactly. Okay. Yes. So we might not be getting it anytime soon. I don't know.
We might not get it anytime soon. Wow.
Unfortunately, that's the sad reality. I mean.
Wow. So on a final note, let's talk about malaria and typhoid for the general population. What are the best ways to go about treating this thing or preventing them? What are the best ways to go about both? Since we have understood that they are like our boy, our friends,
exactly. And are not going anywhere anytime soon. Yes.
And they are not going anywhere.
So for prevention, exactly. So for prevention of malaria, first it starts with you as an individual. Before we now talk about the government, what the government can do. But as an individual, you have to keep your environment clean, no stagnant water, get a treated mosquito nets. Make sure you sleep in under an environment where you have treated mosquito nets. Your room should be well ventilated and all that. Then for people who are traveling to places that are where we have the malaria parasite or malaria disease commonly, you should take medicines or medications that will prevent you from having malaria before you come to those areas. Then for mothers, like I stress, antenatal, very, very important. Anti-malaria during pregnancy, you cannot afford to joke with it. Nutrition, very important. During and after pregnancy, both for mother and the child, very, 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 very important. So then when we talk about from the part of the government, well, the government can do much more in sensitizing. I think by now, Africa nobody should be paying out of pocket for the treatment of and prevention of malaria. You know, I'm not too happy when I see something that is our own body and people still come to the hospital and they pay for tests, pay for drugs and all that with malaria. So the government needs to do a lot more in that aspect, a lot more. There's still a whole lot that needs to be done when it comes to malaria and typhoid. As for typhoid, you have to boil your drinking water properly, keep it, preserve it properly, make sure that your hygiene is at the top level when it comes to even what you use to cook, what you drink. Very, very, very important. Do not leave your food exposed or keep food away from toilets and soccerways and all those things as much as possible. Those are some of the tips that can help us prevent typhoid and malaria.
Wow. Fantastic, sir. Fantastic. Thank you very much for your thoughts. We appreciate every part of it, and it's been very, very enlightening. I can see that, and it's been very, very political as well.
Yes. Thank you so much for having me.
This is Touch a Cell with Tony and the gang. And we can say proudly it's a production of Sickle Cell Advocacy and Management Initiative. Join us again next week by this time for episode 10 of the season 4 of Touch a Cell with Tony and the gang. I remain the black to the bone guy, Yomi Oyelami. We'll see sometime again soon. Thank you. Bye.